Now, Dr. Nicholas Crisp is the Deputy Director General for NHI in the Department of Health, and he joins us now. A very good morning to you, Dr. Crisp. Thank you so much for making the time.
Good morning, and morning to the viewers. Pleasure to be here. Thank you.
So we're hearing of COVID cases on the rise in different parts of the world, fueled by the Omicron BA4, BA5 subvariants. What's happening in South Africa?
So thanks very much for the question. We have had BA4 and BA5 for a long time, and they are the two subvariants that were responsible for our fifth wave. So we have had a substantial wave of that variant in the community for some time. We are still seeing BA4 and BA5 infections, and we would like to caution the public that COVID is very much still amongst us, and those are the two most prevalent subvariants still doing the rounds. Fortunately, we did not get that number of admissions to hospitals and severe cases, and we've not seen large numbers of deaths, although people do continue to die from COVID infection and from Omicron specifically.
So just in terms of the signs of it, this new SA modeling that predicts more cases and hospitalizations, has the department engaged with this information? How are you responding to it?
Yes, so we're part of the global community. We have got as we keep saying, one of the most magnificent scientific communities that a country could hope for. And our science network and the people who are part of those networks are revered around the world. They sit on many committees of the WHO and other global bodies. So they're all party to what is happening. They monitor and report what is being tested and found in South Africa on a regular basis. They obviously keep us in the department well informed. We get daily reports, and when anything looks like it's changing and it may be something we should specifically be paying attention to, they bring that to our attention as well. So it's at this stage a very intensive monitoring program to check whether there's anything changing in our circumstances.
So we're not resting on our laurels, so to speak.
No, we should, as citizens, we should all be out there getting ourselves vaccinated. The vaccine does not prevent infection, and there's a fair amount of what we call immune escape. But what it does prevent is severe infection. And fortunately, our older population over the age of 60 is now pretty well vaccinated. And that's probably the reason why we are not seeing the numbers of severe infections in hospitals. But COVID is still very much amongst us. We know that this virus has the ability to mutate, to change its gene structure. And if it does that significantly, then we get new variants and they may behave very differently. So we need to protect ourselves as much as possible. We do not want to go back to lockdowns and mask wearing and all of that. So we would really encourage the public to go out and get vaccinated. And that means both primary vaccinations, in other words, the first schedules, but also older people and those who have other illnesses to please go out and get your booster doses.
I know that as broadcasters, we're no longer showing daily numbers, but the latest data showing active cases at 5,913 and deaths in the last 24 hours at 3. Are we still vigorously and rigorously monitoring COVID-19 developments in the country?
Yes, very much so. So you can only test and report on what you receive in the laboratories, and we have a very big network of both public and private laboratories, plus a number of specialized laboratories. I'm sure you'll recall our genomic sequencing network, which includes the NICD, a number of universities and other research laboratories, and they communicate with one another all the time. They have a database. They are monitoring samples of all the tests that are tested positive in the PCR tests of all the laboratories, and they are also monitoring wastewater to see whether whether there's any of the virus of these particular subvariants that's circulating in the community. That's going on every day, and as I said, they report to us. So we're definitely not asleep. And from a hospital perspective, hospitals are still maintaining their wards, and they are still able to admit patients. As you've reported, there are several thousand active cases. Many of those are still in hospital, and those people many of them are still sick. So we just need everybody to be aware Omicron is not gone. Please go and get vaccinated.
So, Dr. Crisp, what's the latest with regards to vaccines, their production, the procurement, administration, latest research? What updates do we have there? And uptake?
Okay, so a number of things. Yeah, sure. No, so the uptake is extremely poor. We are vaccinating between 13 and 15,000 a day at the moment, which is pathetic considering that we were doing well over 100,000 a day a while back. We have 20 million doses of vaccine in the country at the moment. And as we have warned, the Pfizer vaccine is starting to expire in September, October of this year. And then we will have only Johnson & Johnson vaccine remaining. Fortunately, it will be potent for at least another year, maybe more. And that should, at current uptake rates, that's enough for many years of vaccination. So we have vaccine. Those vaccines are both still effective against the variants that we are seeing now, at least for protection, good protection against severe infection. So right now we are not in the process of purchasing vaccine. We do have budgets set aside in case we need to buy different vaccines, but right now there would be no purpose of buying additional vaccines.
And just in terms of legislation, we're no longer under a national disaster or national lockdown, but are there areas where the department encourages the continued following of non-pharmaceutical interventions?
Yeah, so we've moved from a point of the Disaster Management Act with regulations that can be made at very short notice into a position where we now use the National Health Act. We had some temporary regulations which were in place for a short while we were transitioning out of the fifth wave and we weren't sure what was going to happen next. Those have all been lifted. The minister made those announcements some time ago. So right now we do not have any particular implementation of regulations or controls. But if needs be, if we get another flare-up or another variant that comes that's aggressive, we would need to impose some form of regulation again. It might just be mask wearing, it might be gatherings again. It will depend on what the advice is that we get and what we see as the behavior of the virus at that time. In the meantime, the review of the regulations that are in place for communicable diseases is ongoing. The period for reporting is not, for people to make submissions is not over. And after that, the health regulations are likely to be and published of us and to provide for pandemics as well as just the routine we see in the health system.
What sort of information or data are you getting from schools, Dr. Crisp, just in terms of an example of a place where lots of people gather at the same time on a regular basis? Are there any flare-ups there, or is it just business as usual?
So at the moment, it's business as usual. The cases that we are seeing are scattered. They're not concentrated. We are not seeing particular nodes of infection. And that's, I guess, a good sign. It means that there's a good immunity in the community generally for the variants that are currently in circulation. So when neither schools nor universities nor workplaces are particular nodes of flare-ups. Obviously, if we do see that happening and if it's reported in such a way, the laboratories will tell us quickly, and then the health departments of the provinces will go out and investigate to see whether there's something that needs to be done about it.
So in a sense, we're saying, in spite of all the global reports of surges in infections, South Africans can rest easy.
Well, I don't know that we in the health departments are not resting easy right now because it's like a lull before a storm. You don't know if the storm's going to be downscaled from a gale to a strong wind or whether it's going to be upscaled to a hurricane. It's unpredictable. This is a very unpredictable virus. It does mutate, and if it behaves differently, as we saw with each of the previous variants that we have had in the country, we could be in trouble once more. But for now, we don't have massive problems. We have just a grumbling epidemic that is going on in all parts of the country right now. You don't need to wait until you get the storm. You need to prepare before the storm arrives, and the best way to do that is to get as many people vaccinated as is possible.
Just before we let you go, I want to ask you two things. One, the latest update in terms of monkeypox in the country. And two, you are the specialist for NHI within the department. What's the latest there?
Okay, so monkeypox, the information we have is we have had 3 reported cases, and there does not appear to be any widespread infection that is taking place. Each of the people who has been infected has been treated, and the NICD continues to monitor and to report to the department and the minister when there are cases. So for now, we're not particularly concerned about monkeypox in South Africa. As far as the National Health Insurance is concerned, the bill is still in Parliament and will be for some time. It's not out of the National Health Assembly yet, and after that, it must still go to the National Council of Provinces. So what we are doing in the department is preparing the administrative capabilities for those functions of the NHI. Some of those functions will need to be strengthened irrespective of the NHI, like the digital health systems, like the way in which we procure our health products and so forth. But we should shortly see the advertisement of posts to strengthen the unit in the National Department of Health, to design the benefits and to manage the preparation for accreditation of providers and so forth. So there's quite a lot of preparatory work going on in the background.
Is there any feedback on the health of National Health Minister Dr. Joe Butler following him being infected with COVID-19?
Yes, he's well. He's in isolation at home. He chaired a meeting that we were all invited to last night or late yesterday afternoon, and he'll be chairing a meeting that we are all invited to attend this morning, and he sounded fine and fit and well. So, yeah, he's fine. Thank you.
Dr. Nicholas Crisp, thank you so much for your time this morning.
Thank you.
Well, there you have it. South Africans are safe for the moment from those reported spikes in infections globally in terms of COVID-19.